Ammonia-smelling discharge. Ammonia-smelling discharge occurs mainly due to bacterial imbalance in the vaginal region, leading to bacterial vaginosis. Other factors like concentrated urine, nitrogen-rich diet, excessive sweating, etc. are also seen to spearhead a foul ammonia smell. The vagina houses various good bacteria that maintain an acidic pH, thereby preventing onset of vaginal infections. However, if the pH balance is disturbed, an infection-prone zone is created. Sometimes infection sets in along with foul odor. The foul, ammonia-like smell emanating from vagina can prove to be quite disconcerting for many women. Embarrassment sets in because they quickly link ammonia-smelling discharge to poor personal hygiene. However, it is important to remember that very rarely is inadequate hygiene level the cause for smelly discharge. So then what causes the vaginal discharge to smell like ammonia? Conditions resulting in ammonia-smelling discharge. Bacterial vaginosis, BV. This is one of the most common infections plaguing the female reproductive system. If your vaginal discharge is watery, white or gray with a fishy smell, you may have contracted bacterial vaginosis. BV can also be accompanied by pain, itching and/or burning. When not to panic. Vaginal discharge is a natural and essential phenomenon of the body. It's the way of the body to keep the vaginal region healthy and clean. Vaginal fluid is nothing but the collection of old cells that previously lined the vagina and which are now sent out of the body. Normally the vaginal discharge is clear or milky white, however, its color and viscosity changes with one's monthly menstrual cycle. Moreover, on ovulation the vaginal discharge becomes thicker, so also when a woman is sexually excited, pregnant or breastfeeding. So if the viscosity of your discharge changes, don't get worried. The amount of vaginal discharge released varies from one woman to another. So if you feel your body is releasing more vaginal discharge, it's completely normal. Every woman has a unique vaginal scent. It's something that is natural and is distinctive to each woman. Some studies also say that the natural scent of vaginal discharge is what makes the man feel even more turned on when a woman is the most fertile. So if your discharge has a distinctive mild odor, not foul, it's nothing to be concerned about. Cause. What exactly causes BV and how is not very clear until now. Nevertheless, it has been observed that occurrence of BV has connection with an imbalance of bacterial concentration in the vaginal region. Normally, a woman's genital area is supplied with a combination of good and bad bacteria, wherein the good outnumber the bad. These good bacteria are seen to fight off unwanted foreign and potentially dangerous bacteria. If there is any kind of imbalance in the ratio of good and bad bacteria in the vaginal area, be it too much or too little, the condition of bacterial vaginosis is triggered. The bad bacteria take over and convert nitrogen into ammonia compounds, thereby causing the foul ammonia odor. BV cannot be caught during sexual intercourse, or from some public toilet or swimming pool. However, it is also observed to occur after a person has had intercourse with a new partner or multiple partners. The reason is unknown. Prevention and treatment. Avoiding multiple sex partners, unprotected sex, intrauterine devices, IUD, vaginal douching, smoking and application of vaginal deodorants or perfumed soaps, can help reduce the incidence of BV. However, those that refrain from the mentioned activities are also sometimes seen to be affected by this condition. Most of the time, BV clears off on its own, and when it doesn't, antibiotics like metronidazole or clindamycin are available to help treat it. Wearing a pad during the day can help curb the foul odor, until the condition clears. However, For pregnant women, the mode of treatment will be different. As the complications, premature delivery, etc., of this condition increase during pregnancy, one should visit the obstetrician immediately. Dietary intake. Did you know the constituents of your diet can also spearhead this foul odor? Well, it's true. One of the causes of ammonia smell down there can also be linked to one's dietary intake of nitrogenous foods. The foul odor is mistaken to be from the vaginal discharge, but actually is from the foul-smelling urine, containing lots of ammonia and urea, that trickles and stains the undergarment. Cause. Vegetables like broccoli, asparagus and other nitrogen-rich vegetables are seen to be the culprits. The leftover oxalates from the asparagus are seen to cause the fishy odor in the urine. Moreover, food items like meat, eggs and other high-protein foods contain large amounts of nitrogen and cause excess ammonia and urea to get excreted in the urine. This results in ammonia-smelling urine. Several food items we consume also have arduous oils that end up being secreted in the sweat. Prevention and treatment. To prevent this condition, make sure you eat a healthy and balanced meal, with the right balance of vitamins, minerals, proteins, carbohydrates, etc. This will strengthen your immune system and arm your body against any infections. Those who suddenly shift to a vegetarian diet tend to consume large amounts of leafy vegetables which cause ammonia-like smell in the urine. So consume everything in moderation. Moreover, consuming yogurt on a regular basis will also help treat the foul odor. Menopause. As a woman enters menopause, the body begins to experience change in several ways. During menopause, the ovaries quit producing the hormone estrogen and progesterone. Besides the basic menopausal symptoms of hot flashes, mood swings, urinary leakage, etc., ammonia-like odor is also experienced. Cause. During menopause, women are seen to not take in enough water. This lack of adequate water results in formation of concentrated urine which imparts a highly stronger smell or odor. Oft, women mistake the ammonia smell to come from urine left behind on the panties, to be coming from the vaginal discharge. Bacteria convert the chemicals in the urine into ammonia-smelling chemicals. Thus, these altered chemicals on the panties are responsible for the foul odor. Another reason can be a vegetarian diet. Many women shift to a vegetarian diet after they hit menopause. The sudden consumption of excess nitrogen-rich foods can also result in the foul odor. Urinary tract infections can also conduce to foul-smelling odor. Prevention and treatment. Women should consume more water during menopause. Moreover, those on a strict vegetarian diet should consume different vegetables in the right proportion. This will help avoid the unwanted smell. In such cases, no particular treatment is required. By consuming adequate water and the right proportion of vegetables, the smell is bound to go away. However, if the condition persists, do not hesitate to consult your obstetrician. Pregnancy. Several women complain of a foul ammonia odor from their discharge at various stages in pregnancy. Cause. Ammonia-smelling discharge during pregnancy can be caused by either bacterial vaginosis or concentrated urine. Bacterial vaginosis during pregnancy is quite dangerous and can lead to various pregnancy complications like preterm delivery of the baby, low birth weight issues, ectopic pregnancy, birth defects, etc. Another cause for the ammonia smell is leakage of concentrated urine. During pregnancy, the body requires adequate amounts of water intake. If the water consumed is not enough, the urine will turn out to be concentrated. Moreover, the pressure of the growing uterus on the bladder results in urine seepage. When this concentrated urine comes in contact with the underwear, bacteria act on it and a foul odor emanates. Urinary tract infections can also be the reason for this odor. Prevention and treatment. During pregnancy, one should ensure one drinks plenty of water and other fluids. Keeping one's body hydrated is the key to keeping the foul smell due to concentrated urine away. Moreover, wearing a panty liner will soak the intermittent leaks and prevent the foul odor. However, make sure you change the liner frequently. In case of bacterial vaginosis and urinary tract infections, the obstetrician will prescribe the necessary treatment to get rid of this condition as soon as possible. Excessive sweating. If we restricted sweat odor to our armpits and feet, we should understand that sweating down there is also a natural phenomenon. Cause. The vulva comprises several apocrine or sweat glands, and as we all know, where there are sweat glands, there is sweat and unpleasant odor. This is because the body's waste product urea is also excreted through the sweat. Moreover, the region also contains oil glands which produce oil. The more the oils present in the sweat, the stronger will be the vulvovaginal odor. When this odor combines with the skin bacteria and detergent from washed undergarments, a foul ammonia smell is released. Sometimes consuming a new vitamin pill can also conduce to foul-smelling vaginal odor. Prevention and treatment. Wearing a panty liner throughout the day is a good solution. Keep changing the liner frequently and ensure the vaginal region is always clean and dry. Wearing cotton panties is also a better option. Wash the vaginal region with antibacterial soap and try keeping the area as dry as possible. In case of excessive sweating, there exist various pills that can be prescribed. However, the medicine will reduce sweating uniformly, in all sweat glands of the body. Washing panties with bleach. While you thought rinsing your panties in bleach solution was a good idea, turns out it's not. Using bleach while washing one's underwear can impart an ammonia smell. Cause. The genital area contains sweat glands that produce sweat. When this sweat combines with the bleach in the underwear, it forms an ammonia kind of smell. Often this smell is mistaken to be coming from the vaginal discharge. Prevention and treatment. The only way to avoid the foul odor induced by bleaching panties is avoid bleaching them. Try opting for the milder liquid detergents that not only wash the clothing clean, but also leave minimal residue on them. Sometimes while urinating, some women fail to empty their bladder completely. The presence of this residue urine in the bladder for a long time results in ammonia generation. When this urine is released, a foul ammonia smell is observed. Then again, some forget to remove their tampon, which results in bacterial growth and again causes foul odor. Some sexually transmitted diseases also cause ammonia-smelling urine. Often women mistake the foul smell from the discharge, while it's actually emanating from the urine. If you want to find out for sure, try smelling the discharge alone, without the panty.